2nd. I'm Steve McCarran.
And I'm Tyra Majors. Let's dive right into the deep end. It might feel like summer just started, but it's already time to start thinking about the new school year.
Oh, man. But yes, it's important. The Washington State Department of Health is reminding parents and caretakers to make sure their children are up to date on all required immunizations before they head back to the classroom. Joining the conversation this morning is Dr. Jamilia Sherls, the director of the Office of Immunization for the Department of Health. Hi there, doctor. How are you this morning?
Hi, I'm great. Thank you. How are you this morning?
We're doing quite well. Thank you. So let's start by talking about the importance of immunizations. Why are immunization requirements in place for students in the first place?
They are in place for our students in the first place because we want to make sure that students stay safe and healthy as they start the school year. Immunizations are a great way also to prevent disease outbreaks in community, and they also keep others in our community who may not be able to be immunized due to immunocompromised status as safe as well.
What do parents or caregivers need to know about immunizations before the start of the school year? How can they figure out which immunizations their child needs?
Absolutely. So first and foremost, for this school year, there are no changes in school vaccine requirements. However, now is the time to get kids ready for school with needed vaccines. In Washington State, certain routine vaccines are required for school, preschool, and childcare, including DTaP, MMR, hepatitis B, polio, varicella, and Tdap. Children in childcare and preschool are also required to get Hib and pneumococcal vaccines. These immunization requirements do apply to all enrolled children, including those who are learning remotely. There are some vaccines that protect against respiratory illnesses like COVID-19, RSV, and influenza. But those vaccines are considered to be seasonal. They are not required for school, but are recommended to prevent severe illness and hospitalization. These vaccines are more commonly given in the fall when respiratory disease activity tends to increase. However, most routine childhood immunizations can be administered at any time of the year. But again, it's highly recommended for kids to get their vaccines required for school before the start of the school year. So definitely starting now. Families can access a complete list of school required vaccines by going to the Department of Health School and Child Care Immunization for Families webpage. And I also highly recommend that parents visit MyIR Mobile at myirmobile.com to see which vaccines their child may be due for. MyIR Mobile is a free, secure platform that you can access on your phone or computer, where you can review immunization history, get reminders for future immunizations, and even print immunization records for school. So it's a very convenient resource we are fortunate to have in our state to help us stay up to date on vaccines. And I personally have used MyIR Mobile many times for myself and my daughter, and it's been very helpful.
Obviously, we're about 5 years removed from the crux of the pandemic, and we've seen this conversation surrounding vaccines and immunization significantly shift over time. Does state data show a drop in immunizations in Washington at all?
So overall, school immunization rates for the 2024-25 school year have remained flat compared to the 2023-24 school year, which means rates have not worsened, but they are not getting better either, which is still a concern for us. As I mentioned, vaccines help prevent illness and disease outbreaks, reduce missed school days. They protect people in our community who are unable to be vaccinated. So it's especially important that we try to vaccinate as many people as possible. In 2024, Washington State saw a 25 increase in whooping cough cases compared to the previous year. And whooping cough is preventable with the DTaP vaccine for younger children or Tdap for children 11 years and older. But those vaccine rates have also steadily declined since 2019. Our State Department of Health is continuing to work closely with providers, local health departments, tribal clinics, and other immunization partners around efforts to boost state immunization coverage rates. And again, keeping children up to date on required and recommended immunizations is one of the most important ways we can protect their health and keep them learning in school.
For any parent or caregiver that might be on the fence about immunizations and vaccines, what's your message to them?
I would highly recommend that they visit their child's healthcare provider. Healthcare providers can talk to parents about recommended vaccines, can address concerns, and can advise when a child is due for vaccines. So I highly recommend that. And if a child does not have a healthcare provider, on the Washington State Department of Health webpage, we do have a map that shows which providers are enrolled in the childhood vaccine program. So parents could look there and select a provider and make an appointment to be seen with their child.
Yeah, those vaccines stop the spread of disease and help save lives. A really important message as we get ready for the brand new school year. Doctor, thanks for your time this morning. I appreciate it.
Thank you so much for having me. Take care.
Thank you. For more information and resources on school and child care immunizations, we made it easy for you. Scan the QR code on your screen. That'll take you directly to komonews.com/hotlinks. From there, you'll find a link to the State Department of Health's website. So